Welcome back to the medical marijuana debate. Remember to keep this conversation going on Twitter. We're asking you to use the hashtag FLPOTDebate tonight. The medical community remains divided over medical marijuana, including the two doctors who are joining us right now. Dr. Stephanie Haridopolos. We practiced that many times, and I botched it when we're live, of course. Doctor, nice to see you. She's a family practitioner, president of the Brevard County Medical Society, and an opponent of Amendment 2. Dr. Clifford Selsky is CEO of Family First Pediatrics in Winter Springs, the founder of the Children's Center for Cancer and Blood Diseases at Florida Hospitals. To both of you, we appreciate your being here this evening. Dr. Haridopolos, you won the coin flip tonight, so we're going to begin with you if I can right now. Simply put, what do you say to parents in this state that are convinced and believe that medical marijuana can help them treat a child who's dealing with a debilitating disease right now like cancer, ALS, or anything else?
So the children right now have the ability, as the Senate Bill 1030 is going to be implemented over the next few months. So Senate Bill 1030 was passed by the legislature and signed by law by Governor Scott. A lot of people are confused and they don't realize that this will be available. And when you have a Senate bill already on the books, that can be used as a vehicle to expand it in a safe and regulated way.
So why, if this does have any medicinal benefit, wouldn't you support something that could support those individuals?
So I'm not against Senate Bill 1030 or Charlotte's Web or low THC non-smokable form of marijuana. I agree there are medicinal benefits. A lot of physicians do. But we certainly cannot, and overwhelmingly we do not support smokable marijuana. And there's 15 national physician organizations that are against it.
So let's focus on this conversation right now. The Charlotte's Web law that's now on the books in the state of Florida. This is that no-high marijuana, effectively often served in a capsule, right? So give us a sense of why that's not sufficient in this state.
Because the American Neurological Society has actually come out on record stating that cannabidiol does not control all seizures, but yet a combination of the different cannabinoids and terpenes within the plant has beneficial effect on seizures in subsets of patients with
cannabinoids
seizures.
and terpenes, I have no clue. So the gist is, the bottom line here is, you're saying that doesn't work well enough.
It's not the be-all and end-all. There are still going to be children who have intractable seizures that could be helped by the chemicals within the whole plant.
The frustration for opponents right now, their suggestion is that marijuana is a gateway drug. Is marijuana a gateway drug?
I don't believe so. It's a gateway drug if you've got a addictive personality disorder, but as it stands alone, it's not a gateway drug.
We've been researching for this debate for several days. It's hard to find any evidence, any consensus on this. Is marijuana a gateway drug?
Well, when you start using marijuana in the adolescent years, you prime the endocannabinoid system. That means that you're giving the brain this reward for a drug, and then that leads to wanting to have rewards of other addictive drugs. 1 in 6 children by age 16, if they try marijuana regularly, will become addicted. At age 14, 1 in 4. So that is a high addiction rate, and we need to worry about how it affects the IQ. Long term, there's major studies that show it affects the IQ and the neurocognition.
And you were signed there. Your take on that?
Again, I think the issue here is that we're talking about the medical use of marijuana, not the recreational use of marijuana. And if it can be regulated and controlled by appropriate legislation to support the amendment, then I think we're ahead of the curve.
Well, that's a good topic that you raise. And Dr. Haridopolos, Florida, this state struggled to get a handle on pain pills in this state for years, right? You led the effort, lobbying lawmakers firsthand to make sure that there was tougher regulation and enforcement of this. And now, generally, Florida's got it under control. Yeah. Your efforts worked. So why shouldn't we believe that the same wouldn't work with marijuana?
Well, because it's a constitutional amendment. Constitutional amendments supersede any statutory law or regulatory law. Once it's enshrined in our Constitution, you cannot change it. Those rights will be given to businesses and patients, and those rights will be fought for. So the loopholes that exist, i.e. you can get this at any age for any disease because of the previous segment saying any other medical condition, that really can't be fixed. The Department of Health estimates that there's going to be almost 1,800 pot shops in the state of Florida. That's more than Walmart, Starbucks, and McDonald's combined. And that cannot change. That is going to, this is big marijuana business. That is a multi-billion-dollar business, and they are waiting for this to pass.
Your thoughts on that?
At this point, we are about to embark on a effort to compassionately provide a medicine to people who need it. The fact that certain people can become addicted to this, I think, is an aside. There's patients that we treat all the time for different conditions that can get addicted to the legal medicines that we prescribe.
Doctor, in the state, don't we already prescribe medicines for kidney medications, diabetes medications, cardiac medications that are considered dangerous and even potentially deadly as it is right now?
Yes, but they're FDA approved, and we know what their dose is. We know the strength. We know the potency. We know if it's what the side effects are. Right now, this is a free-for-all. We have no idea what the quantity was going to be, if there's going to be mold or pesticides or insecticides inside the marijuana that's grown.
How do you deal with that argument?
I don't think anybody realizes, but I've been a pediatric oncologist in this state for 23 years now. Every drug I've given to a child is not FDA approved for that purpose.
If you can't give us a sense that this, because it's not FDA approved, will not come with a prescription, it's going to be, according to the amendment, a certification.
A certification. Right.
So is that different, and should we be concerned that anybody can write a certification?
Well, prescriptions, again, and this was brought up in the earlier segment, basically go against the current federal law, which classifies marijuana as a Class 1 drug, which has no medical benefit. But we know that it does. And there's a body of evidence that says it has lots of effects.
And I return to the same spot that we started this conversation. Florida already has a cannabis law on the books. It's for Charlotte's Web. Why is that insufficient?
Again, because that is not the only thing within that plant that can treat the diseases that physicians could use the plant for.
Is there medical evidence that it works? Is there medical evidence that marijuana works?
Yes, absolutely. There's a whole body of evidence. Israel right now is doing clinical trials, looking at the effects of medical marijuana.
Should we wait till they're done?
No. No, because we've got a body of evidence that spans 40, 50, 60, 70 years that shows that it's effective. It's utilized in 30 countries around the world.
Closing thoughts, 15 seconds, go ahead.
I'm a mother of 3. I really do not want my children growing up when there's pot shops on every corner.
I'm a father of an 8-year-old, and I want to make sure that sick people get the medicines that will work and make their life and quality of life better.
Dr. Selsky, Dr. Haridopolos, thank you both for being here. We appreciate it. We appreciate our guests being here. Remember, Election Day is November 4th, less than 2 weeks away. From Florida to Capitol Hill, count on NBC News and your local NBC station for complete Decision 2014 coverage. Thank you for joining us. Have a good night.